So why do you think that, they haven't been studied as a therapeutic, really to this point?
Well, they have somewhat, and there are a lot of papers out there. I don't want to short anyone, right, or kind of be insulting. There are a lot of papers out there, but they were still limited, right? So it's like we're going to take a terpene or terpene extract, we're going to give a certain amount to patients, and then we see the pain relief. But for whatever reason, I don't fully understand why those next steps weren't taken. Like, what are the side effects? What's the pharmacokinetics? What's the minimal dose that we need to be effective? And really like formalize and systematize this investigation so you could really turn it into something. Um, I'm just spitballing here. I don't have any evidence for that, but like one of the reasons could be because it's generally regarded as safe. Maybe you can't get a drug company interested in making a product because they can't patent it. And that's where I've been working. All the companies that I've been working with in this space are all smaller companies, right? That care about cannabis, that care about terpenes. They're not looking to be Pfizer. Maybe that's why they're the ones that are willing to tackle it, and maybe that's why they haven't been tackled in the past with some of the larger groups. And it could also be the possibility that funding has been harder to come by. I don't really know. So we were able to get funding from this work from a portion of the National Institutes of Health, the NIH, called the National Center for Complementary and Integrative Health, the NCCIH. So kind of a sub part of the NIH. And they had this program where they were specifically interested in looking at terpenes and minor cannabinoids. And so I will say, just in general, the cannabinoid field, has grown a lot recently. The last 10 or so years, all of that has grown. Funding's become more available. People are becoming more interested. And then some of these minor components or understudied components of the cannabis plant, like terpenes and the minor cannabinoids, those have also been growing very strongly as well with that interest. So maybe the time is just here.